Hello, my name is Linda Stremel. I'm a physical therapist from the Wellness Center in Mount Shasta. We also have a location in Weed at School Hill Wellness. In my presentation today, I'll be talking to you about the shoulder joint. You'll learn about the basic anatomy of the shoulder, how it works, what can go wrong with it, and what physical therapy can do to help restore motion and mobility. The first component of physical therapy treatment is a comprehensive evaluation. Physical therapists will evaluate posture, scapular control, how your scapula or your shoulder blade moves and how the muscles control it, and the preciseness of how it positions your arm and shoulder, and your rotator cuff strength, coordination, endurance, and the mechanics of your shoulder joint and how it works. Let's look at those 17 muscles that control what the shoulder blade and the shoulder joint do. The pectorals, the biceps, and behind we look at the trapezius, the deltoid, the tricep. The shoulder joint is characterized as a ball and socket joint. The ball is here, and this is the socket. Another joint that's characterized as a ball and socket joint is the hip joint. And as you can see here, there's a nice deep socket, and the ball is seated in this nice deep socket. The pelvis is firmly attached to the spine, and it's a very strong, stable joint, especially suited for walking, running, and bearing weight. The shoulder, on the other hand, is a joint that's much more suited for mobility and flexibility. It allows us to reach, scratch our back, feed ourselves, and right. It's designed for precision. Scapula, or shoulder blade, glides on the rib cage. There's no bony attachment back here, attaching it to the spine as we saw down here with the pelvis and the hip. So we've got a shoulder blade that's gliding around, controlled by 17 muscles. In the front, we have the collarbone that comes and attaches to the breastbone right here. So let's take a look at the shoulder, and specifically, what is it that holds it all together? Because as you can see, it's not a nice deep socket like we have in the hip joint. I have here a model of the shoulder joint. You can see all the components that we just talked about: the shoulder blade, the collarbone that attaches to the breastbone, and then these red things, they're muscles. We have these are the rotator cuff muscles that we hear so much about. They sandwich the shoulder blade, and you can see the rim of bone here with the rotator cuff muscles sandwiching the shoulder blade. And the rotator cuff tendons, they form an actual cuff of tendons that control the arm bone or the head of the humerus. If you look in here, if you look deep to the rotator cuff tendons with the head of the humerus removed, you can see a small disc of bone. That is the bony socket. It's not very stable. The real stability of the shoulder joint is formed by the rotator cuff tendons and how they grasp and control the movement of the shoulder joint itself. Let's talk about what can go wrong with the shoulder joint. As you look at the shoulder joint, it is susceptible to dislocation. This is an injury that we see in young people. However, much more common than a dislocation is a chronic impingement syndrome that happens slowly over time. So I'm going to show you with my hands how this impingement and microtrauma can happen to the rotator cuff tendons. So if you have, my right hand is the bony acromion part of the scapula, and my fist is the ball, the head of the humerus. If the rotator cuff tendons aren't working precisely, when you raise your arm, the head of the humerus and the rotator cuff tendons get pinched. with the scapula. However, if the rotator cuff tendons are working precisely and with coordination, the head of the humerus descends slightly and rotates so that when you raise your arm, it's free and clear of that impingement and pinching, painful pinching sensation. Chronic impingement over time can result in microtrauma that causes tendinitis. It can also result in an actual tear of the rotator cuff tendons. As we see in this illustration, we have a rotator cuff tear that could be from, probably from an injury, quite possibly after years of microtrauma, and then maybe a fall on an outstretched hand with a tear of this tendon. Then here we can see a surgical repair of that tear, and that's a rotator cuff repair. Today I have with us Art Horvath. He's had a long history of shoulder problems with his right shoulder and several surgeries. We're going to demonstrate some of the techniques that we've used in physical therapy to rehabilitate his shoulder. Okay, so Art, you can go ahead and lie down on your side.
Facing this way?
Mm-hmm. I like to start out with, that's good, with loosening up the shoulder blade. And so we do some massage techniques along the inside border next to the shoulder blade or the scapula next to the spine, and just kind of loosen it up here. I'm kind of sliding my hand and my finger under the edge of his shoulder blade. We would follow that with just gently moving the shoulder blade up and down, kind of in a diagonal, to free it up, and a little further towards your nose. That's good, okay. And then I'm actually going to have Art pull up towards his nose with his shoulder blade. Yep, that's good. Pull up. I'm giving him a little bit of resistance to this to help strengthen the muscles that control the shoulder, those 17 muscles that add precision to everything we do. Okay, now push down towards me. Yep, that's good. Mm-hmm. Wonderful. Okay, all right, now you can turn over on your back. Mm-hmm. We're going to work a little bit on your range of motion, just how well your shoulder moves. Stretch just a little bit as long as it's comfortable. Yep, okay, that's good. And again, we'll come up this way. Rotation as well. Again, respecting where the limits of Art's range are and what he can do in comfort. Okay, after we free up the shoulder blade and get the shoulder moving well, then we start working on strengthening. And the first step in strengthening is actual isometric exercises, where Art is just pushing against my hands, without moving. This is basic exercises for the rotator cuff muscles. Loosen up the shoulder a little bit. Nice. Okay. And then I'm going to have you sit up, and we'll show them the strengthening your rotator cuff muscles. We can move on to a little more dynamic exercise, and go ahead and pull against the band. That's good. Come all the way back to midline. Yes. There, that's nice. Now, any pain with that? No, that's comfortable. Okay, so now that's external rotation. Now we're going to work on internal rotation. Since Art's been through a lot of rehabilitation, he's done these exercises a lot at home. And thank you, that's good. And what he's happy to tell us today is that he's back to playing ice hockey competitively with the young dudes and having a great time.
Absolutely. Well, thanks to your rehab work, I was skating again and playing hockey in 3 months. I think it was 3 months after the surgery. is how soon I was back in action,
Good.
which is amazing.
Well, and we started out with modalities and techniques to decrease Art's pain, decrease the inflammation and swelling. We used ultrasound, phonophoresis, where we use cortisone treatments to drive the ultrasound to drive the cortisone medication in, ice, anything that we could do to make things more comfortable and allow us to progress his exercise program according to his tolerance. In closing, I encourage you to address musculoskeletal issues and pain that may be either from a new injury or something that's been bothering you for years. As physical therapists, we are motion specialists. We help restore motion to joints and to the body and reduce pain. Please talk to your doctor about the possibility of physical therapy or give us a call or stop by. My name is Linda Stremel, and I appreciate your watching today.